I wasn't kidding when I said this next panel, we're going to hear about how we're going to pay for all of this. We've talked about research gaps. Folks, let's hold it down, please. We've talked about research gaps and identifying information needs and how we're going to fill those, and we've talked a lot about where this needs to go as a topic. But as we're all painfully aware, research is driven by what resources are available for it. And so I thought a good thing to do to wrap up in terms of the panel discussions would be to pull together a group of people who represent different sources of funding, and not always public funding per se, but internal to the organization in at least one case, and how they're thinking about this topic, if they're thinking about the topic, if so, how, and what kind of resources are they thinking to devote to this sort of thing, and what are the opportunities and potentials. So to chair this, I've got a friend of mine who is a good partner for the Soil Health Institute, Dr. LAKISHA ODOM, who is a scientific program director for the Foundation for Food and Agriculture Research in Washington, D.C., and she's pulled a great panel together. So LAKISHA, you're on.
Good afternoon, everybody. We thought we'd do this a little bit differently and have it more be conversational. So everyone's going to stay seated, and we'll have a series of questions, and we'll just leave a bit more time for questions from the audience. I know one of the things that I've enjoyed the most is a number of the conversations that's around the technical sessions and the breakout sessions today. As part of the steering committee and a participant, it's been really exciting to see how open everyone has been, and how it's when you are part of something and you plan something and it exceeds and far beyond your expectations. That's such an amazing feeling. So thank you all for that, right? Thank you all for being so open. So one of the things that I think we thought about, as Stephen said, as we were putting together the panel is, while we know this is by no means representative of all the potential funders, we wanted to at least have folks representative from the public and private foundational spaces, industry, and the federal spaces. And we have a number of questions, and then we'll talk more about what you want to know from us. I'll be a moderator and a panelist, so I'll moderate myself. So we'll see how that works. Because as Steve said, I'm from the Foundation for Food and Agriculture Research. We're a 501c3 nonprofit foundation, and we seek to foster public-private partnerships in the agriculture and nutrition funding spaces. For those of you who want to know more about us, catch me on the break. So one of the things I'll do is introduce all of our panelists, and then we'll dive right into the questions and then see what we can get from those conversations. So the first person I'll introduce is Heather Henry. She's a health science administrator for the National Institute of Environmental Health Safety, where she oversees Superfund grant programs. Then we have Bill Hairston. Wait, Bill, there's Bill. He's the director for product development for seed growth for Bayer Crop Science. Then we have Louis TUPAS, deputy director for bioenergy, climate, and environment at the USDA's National Institute of Food and Agriculture. And finally, Paul WOLFE, who's a program officer in the Mississippi River program for the Walton Family Foundation. So I think we have a nice representative group before us. So one of the first questions that we did ask is, where does your organization tend to fund in the soil health or human health space? So I'll pretend to sit here, and then I'll answer the question first, and then I'll turn it over to the panel. So at FAR, we tend to fund in 7 challenge areas. So one of those is healthy soils, thriving farms. So clearly that's a priority for us. In fact, one of the areas we have identified that we would love to prioritize in 2019, 2020 is looking more into this soil health, human health nexus. But another space that we're looking into is we have areas that we call Making My Plate Your Plate, which looks at nutrition. And we're also exploring the connections between nutrition and health, and so we're also looking in those spaces. And so we like programs that kind of can cross our challenge areas, so it feels very natural that there may be a lot of opportunity to cross some of the priorities that we've identified in 2020. So now I'll pass it over to anyone that would like to speak first on the issue.
Thank since I'm sitting on the end, I can
Yep.
go first. As she said, I'm Paul Wolfe with the Walton Family Foundation, and I work in the Mississippi River Basin. And I think to steal something from Bruce, about stretching, I think this is a really interesting topic for us, but it is a stretch topic. But I think, and that's a good thing, because we, at our core and the program that I work in, the foundation works on several different things, but I work on water quality on a local, regional, and national level in the Mississippi River Basin. And so, there are while water quality in itself is not, doesn't, I think, scream human health, I think in my world, there are a couple of connections. One is obviously we focus on nitrate and phosphorus pollution in the Mississippi River that ultimately results in the dead zone in the Gulf, but we also focus on the local level, and we have a huge nitrate pollution problem in the Midwest that we are trying to address through our work, and that is a human health issue for those people that are living and drinking the water across the basin. And I also think in a much more indirect way through the food supply chain. I think I've heard it a bit today alluded to, but we in where we work, we focus a lot on corn and soybeans because they grow a lot of them in the Midwest and in the basin. And those corn and soybeans go into the food supply chain mostly through animals and eventually into human consumption, while the nitrates and the phosphorus and the other concerns are not necessarily coming through completely in the food train. The companies that sell the food have sustainability commitments. They have concerns about where they're sourcing their products from. We're interested in extended rotations and other conservation practices that can have impacts on what's grown, and you need markets for those things. So there's a lot of secondary and supply chain connections, but not on a direct level. So that is where our interest lies.
Thank you. So I'm from the National Institute of Environmental Health Sciences, NIEHS, and we're one of 27 institutes with the National Institute of Health. And so our institute, as it sounds, is interested in the intersection between the environment and human health. And so we have a variety of toxicology research from basic to very applied to the point of being epidemiology projects. And then as an extension of the Superfund research program, which is the group that I'm a part of, we also do remediation technologies and detection technologies for some of these environmental toxicants. And when we think about environmental toxicants, we're generally talking about hazardous compounds in the environment that are non-microbiological. So these would be compounds that might have resulted from chemical exposures or industrial byproducts. It may also include naturally occurring compounds that are hazardous, such as arsenic. And so we have anywhere where there is an intersection between the soil, human, and environmental intersection within that, hazardous component, hazardous substance interaction, we could potentially find that within our mission. And while we do talk about basic research, and certainly innovation is really important in our institute, we also want to make sure that gets applied, that this new research finding gets applied. And so we do have many opportunities for research translation. We also highly value community engagement. And so we find all of this to be very important to our mission.
So I'm Louis TUPAS. I'm the Deputy Director for the National Institute of Food and Agriculture for Bioenergy, Climate, and Environment. And what we support is the fundamental and applied research on the microbiological side of the spectrum and other biological processes that impact food production, but we're also interested in contaminants, for example, hormones that end up in the soil from livestock. So those are the types of contaminants that we're interested in. But we also like to see the full spectrum that leads to the positive outcomes for food safety and nutrition. So we look at soil as the medium that ends in a product that is safe and that meets nutritional requirements. The other approach that we have is the more system science approach, where we're looking at the outcome for food security. So we're dealing with this larger broad spectrum of the value chain, where we're looking from the beginning to the end of an outcome that we have a safe and secure food system that meets the demands for nutrition, demands for quantity and quality, but also for security against any types of attacks to the food system. So we're interested in those types. In addition, we're kind of focused right now on microbiome type studies, data, which I heard was one of the important things, and we apply them throughout NIFA, not just in our foundational fundamental science and system science, but we have programs like Beginning Farmers and Ranchers that teach these management practices to beginning farmers and ranchers, how to manage soil. So those are our spectrum of opportunities from USDA.
Thank you. My name is Bill Hairston. I'm with Bayer Crop Science. And I think the primary area of intersect between what we're doing in Bayer and this conference is in the area of developing biologicals that are used in seed and soil application with the goal of improving both soil health and also plant health and ultimately improving yield for the grower. So we've dedicated a significant amount of research. We have a group that's located in California that this is their sole purpose. We have about 50 people there that are working in this area. And so they're doing a lot of basic screening, and then my team is doing a lot of the early screening in the field to try and identify these candidates, and then ultimately bring something to the farmer that provides value. Another area, this would be more of a white space opportunity, would be, and some of you may have heard about this, but we recently signed an agreement within the last year with Ginkgo to form a joint venture where we're actually working on developing a microbe that will fix nitrogen in cereal crops. So we're also looking at kind of some white space opportunities, some really new opportunities that could really dramatically, I think, change agriculture.
All right. Thanks so much. And the next question that I thought might be interesting to ask is, were there any spaces that you didn't hear or you thought you might hear, or there were some spaces for opportunity that you might like to talk about? Yes, no, me?
In terms of
Of what
gaps
you
in
heard, right?
research?
Yep, and gaps in research that were here, yeah.
Well, I haven't been here the whole time, but I do think, there was one area, how to monetize soil health. I think somebody mentioned it as a gap, and I think that's something that we are very focused on. Mm-hmm. Our research, we do a lot of practical and in the field work to improve water quality in the Mississippi River Basin, but we also do fund some research, and a lot of our research is focused on what are the practices, cover crops, strip till, no-till, what are the practices, what are the impacts on water quality, what are the best places to do it, and how you do it. But one thing that we have struggled with and we're continuing to work on, and we do fund some research, but I think it still needs a lot more, is how we convince farmers on a large scale to institute these conservation practices that improve water quality. Mm-hmm. But and I should say, yes, I say water quality, but they also sequester carbon. They also reduce soil loss and some of these off-farm and community benefits. But we have trouble showing farmers that they benefit them. And outside of a regulatory structure where we're trying to work, we need to find ways and understand better what are the pathways to putting these practices that improve soil health and ultimately improve human health into widespread practice, because they're just not there yet.
Well, maybe I'll use this opportunity to say a little bit about NIEHS has a new strategic plan. And so I see, out of hearing people talk in the time that I've been here, and I've very much enjoyed getting to hear about everybody's very different perspectives. I certainly see opportunities with, we have a laundry list of things that we're interested in, and since it was just released, I don't have it memorized. But within the biological research area, we're interested in individual susceptibility, so meaning what makes one person more susceptible to disease versus others. So that could be the time of exposure, a lot of childhood exposure that we're talking about here today. Also, people in their elderly years, you know, what kind of exposures are they getting that may really impact their health outcomes. Microbiome is number 2 on our strategic plan list, and I've heard that many times today, so I think there'll be lots of opportunities for partnerships and thinking about, again, the human health connection when you're talking about microbiome. Exposome, I think I've heard that a couple times, probably in the perspective of the bioavailability, but just to point out a little something that I actually have here. This is a little tool developed by one of our grantees. You know, it's to all intents and purposes, it looks like a bracelet, but it actually can be fitted with compounds so that it will absorb and pick up a variety of contaminants that a person is exposed to throughout a period of 2 weeks or whatever period of time that the study lasts. So you can understand what a person's personal exposure is, and you could probably put it on farm animals too if you really wanted to. You could see they would look very nice. So that's the exposome connection there. Co-exposures, I heard, maybe soil scientists have been thinking about co-exposures for a long time. Toxicologists act as if it's something new. I heard that yesterday. And certainly we do appreciate how important it is to know about mixtures, and even more broadly than just contaminant mixtures, but also quality of life and other sociological indicators. And so that is something that our institute hopes to take on, and I see many opportunities within this community for going towards that. Predictive toxicology, so again, that's rapid testing for toxicological endpoints. And then big data, we're all talking about big data, and NIEHS really sees this as an opportunity to take big data and move it into action, and so that's where a lot of our community engagement, working with end users such as state groups, other federal agencies, creates opportunities that I think can be explored among this community.
So thank you. I'd like to touch on a few points, but first I'd like to compliment Dr. Woteki for GODAN. That is something that we're progressing with, which is the Global Open Data for Agriculture and Nutrition. Did I get that right? Yeah. That's a big effort on our part, and it's our big effort on data and data management. So we're continuing there. The other is, someone mentioned social science. And that's the other area we're really trying to focus on in a transdisciplinary way. We'd actually like to see more projects led by social scientists, because there you get a perspective that's from the stakeholder, what they need, and we create the research through that process. So it's not just curiosity-driven or applied-driven, it's stakeholder-driven. So we'd like to really, that's one of the things that I appreciated hearing from the audience. And then the other one was from the previous session, is soil health policy is collaborative. Was that Bruce?
Yeah.
Who said that? But that's true. So the science-based organizations are here to provide the basis for that science policy, and that's the other emphasis that we have here, is we need to undertake the research that will explore all the aspects, and that's why the group I was with this morning that was looking at the value chain and looking at life cycle analysis, the point that we have there is decisions are made based on that information. And the better information that we have, the better decisions that we make for ground level efforts from the farmer to more national efforts that look at future initiatives.
Well, I'll make comments from two areas, one in an area that we're working in and one in an area that I learned about yesterday. But as I mentioned earlier, that we are working in the area of microbials and applying those to seed and applying them in the soil. And we have a whole lot to learn about the microbiome and just how that influences their performance. One of the things you'll hear quite often when you hear about biologicals, sometimes I think unfairly, is about their consistency of performance. And so, but what we're doing today primarily is just focusing on testing these materials in a wide range of conditions and making our selections based upon those strains that perform geographically under geographically diverse conditions, under a wide range of soil conditions. But it would be very helpful, and one of the things that I think we need to do is to better understand the soil microbiome to the point that we understand, how can we better design and select these strains from the very beginning. And another area that's really outside my area, but I heard a lot more about lead contamination than I ever expected that I would hear. I knew it was an issue, but I had no idea just how widespread and how significant this issue was. And I guess one thing that I was a little bit surprised at, and I would just be interested in hearing more about at some point, is how much effort is being put looking at remediation. And that's something that, given the significance of the problem, that I would have expected to hear a little bit more about.
Thank you. And I'll put on my panelist hat again and answer that question before I ask the next question. And I think my question would be, or my answer would be less on the research side and more on the funding side. I think just as policy is collaborative, funding would be too. And so on a lot of the presentations yesterday, there are a whole host of other funding opportunities I think that we're not thinking of. There are a lot of nonprofit and there's a lot of industry support that could be possible, that could be available in this space. So I think as we move forward and think about how we can fund these opportunities, I think it'll take a collaborative effort and public-private partnerships. So the last question, before we turn it over for Steve to come up to ask questions from the audience, is, and I think Bill started it, is what did you hear during the conference that surprised or excited you? And I would say that one of the things that surprised me was that there was a stroke belt. I did not know. I went home and told my mama. And one of the things that excited me was the concept that was presented about using kind of a risk assessment framework to build this out. That was very intriguing to me. I don't even know, I'd love to just explore it a bit more. So if anyone else would like to just think about or share what might have surprised or excited them during the conference.
Well, I guess I'll continue because I already mentioned the fact that I was surprised at the extent of the issues associated with contamination of soil by lead, just how widespread that was, particularly in the urban areas. But another area that came as a complete surprise to me was the information regarding the stroke belt. When I first heard that, I expected to hear, well, maybe you're eating too much fried okra and too much chicken fried steak in that particular part of the country. But the information that was shared to me was really shocking, that the correlation that was being made between microbial populations and also humidity, water table, and they were showing similar observations in the United Kingdom. And so in terms of really being surprised, I guess that was probably the area that I was most surprised at.
So one of the things that I heard, I think it was also in the previous session, was the role of the state. Well, the land-grant university system is state-based. And that's one of the things I was also happy to hear, was involving stakeholders in this whole process is very important. And you do that through cooperative extension, you do that through the land-grant system, and to be able to connect with them, as well as other networking resources that they have, in all their program areas, not just in natural resources. They deal with family and consumer science. They deal with 4-H. They deal with all kinds of other programs that impact the communities. So being able to involve them in all aspects that have some relation to soil health and productivity and farming. Get the youth involved. It's lifelong learning from that perspective as well. So being able to reach those programs, and I'd really like to emphasize the importance of education and the development of a workforce in this area, because we have to continue the development in this area as well. So it's important to also look at how we are educating those in the agricultural colleges, but also in many other university systems that have an impact on producing those students who will graduate and work within their communities, being able to be community leaders as well. Let's continue to foster that environment where there are people who are willing to work in this area.
Something that surprised me, maybe it shouldn't have, but hearing so much about economics and what the economic impacts are of one policy, making a decision to do something here and what the impact is there. And I see that also as an opportunity, and I know that's something that our program is really looking to do a better job of, is to understand better the economics of certain health interventions, understand how impactful they are, what the prevention and intervention successes are, because I think that helps build even a better level of evidence to start using some of these prevention and intervention strategies.
I would only add, I think, related to the lead question, is that and it's probably not a surprise to people here, but given the cross section of specialties there are, is about the chemical side of this, and there obvious is a huge human health connection directly to lead in your yard or asbestos or whatever it is in soil, but that is not something that in my world, when we say soil health, that we even think about. I mean, in the agriculture world where I work, when we talk about soil health, we're talking about bulk density and organic matter and raising and making better, more microbial in the environment and in the soil, and trying to build up soil to increase soil health, on a very broad landscape level. But it's interesting to hear how much discussion there is about what I would, and maybe I'm wrong, consider a very spatially restricted issue of toxics, the chemicals in soil, because I'm looking at such a broad, thousands and millions of acres of land, and soil health just has a different connotation. So seeing in my mind, it's something I'm going to go back and be thinking about, is that soil health is not just that kind of the silo that I guess I'm in a little bit.
And while Steve comes up, I do have one funding opportunity that I'd like to share. It's been coming across my desk, and it came across right before I got up here. And I cleared it with Steve, so he said I could say something about it. But there's a Food Shot Global is having an Innovative Soil 3.0 challenge. Nominations are open now until December 1st. They're looking for innovators in soil science, and there's I believe, $100,000 prize to those that are innovating in that soil science space. For more information, see this lovely woman here with her hand up at the break. Not me, her. Say it again. Over $500,000 prize. I am sorry. Over $500,000 prize. So you really want to see her, not me. I don't know that much, but she knows everything. And so nominations are open until December 1st, and it's all for soil scientists, which is a number of folks in this room. So.
So if you wanted to hear about our funding opportunity, there you just got one. Okay, several questions I sort of mashed together here. One thing that I was kind of trying to listen for as I listened to the panel, and I was trying to read between the lines, but I'm just gonna ask the question straight up. How much discussion has there been to date in each of your organizations about this topic, soil health, human health linkages? has there been a lot, none? This is the first I've heard about it. Some, I'm not in the loop. I'd really like to go across and get a sense of how much discussion is there going on in your respective organizations about this specific topic, and do you anticipate that could change? So.
Okay. Well, I'd say that all of the discussion that's taking place within the organization that I'm aware of occurred after I got the invite, so I'm not aware of any discussion that's taking place, prior to that. Do I think that could change? I do. I mean, Bayer is a crop science company, but we're also a healthcare company. I think it's just a matter of understanding what our fit, how we might fit into this equation, what might be the opportunity for us. But again, this is just my first exposure to this, and I've learned an awful lot. So I think there's certainly a need for more people in the organization to be aware of the opportunities and the needs.
So soil health as a very specific topic is one of many discussions that take place at NIFA. Soil health as part of a system is the dominant discussion right now at NIFA. So we look at soil health as part of a system, and that's what's driving a major part of our funding opportunities is the systems approach, which soil is part of. Soil is also part of other efforts that we have with the Department of Energy, the National Science Foundation, NASA, because we look at soil again as part of a system that they are involved with through observing systems or generating new knowledge with regards to energy production. So that is the other linkage. And with the National Science Foundation, it's the nexus of food, energy, and water systems. So we are not isolating soil. We do address fundamental principles and applied aspects of it, but the dominant conversation is soil as a major component of the large agricultural system.
And I would say soil health contamination, soil human health contamination intersection, that we talk about soil health more indirectly as opposed to a specific topic. But that would come up very frequently when we talk about community engagement, particularly with regard to lead, remediation efforts, communicating soil bioavailability to communities. What does that mean? That kind of thing. Also, the safety of produce that comes out of urban gardens. So certainly with regard to community engagement, that discussion comes up a lot. Another area that we're very interested in is disaster research response. And so what are the impacts of the flooding events that have happened? What impacts do they have on soil quality? Again, we're talking about that soil contaminant interaction. But we also understand how important that is to human health. And then lastly, specifically with the Superfund research program, these technologies that are developed for the remediation of contamination in soil, as well as the technologies being developed for detection of contaminants in the soil, we see as a very important prevention tool. And so that directly leads to human health. But again, it's not always perceived that way. But when we talk about new ways to clean up and to screen for contaminants in soil, we feel that is directly related to human health.
I'm going to say no until I was in Albuquerque at the Soil Health Institute meeting earlier this summer when there was a speaker, or a lunch speaker from California, and I forget her name, professor, that gave a lunchtime PowerPoint presentation on this topic. I mean, we've certainly thought about the health impacts of water quality in the Midwest, and we focus a lot on soil health, but not in the way that was presented in that presentation. So I think this is, if this can be another tool in the toolbox to help leverage, use to leverage to bring focus and to push for more soil health practices in the Mississippi River Basin, I think we like that. Because that ultimately leads to our water quality goals, but also has as I said, lots of other positive effects. But because we do need more tools in our toolbox to help show why this is important, and if we can say that there's a health benefit, maybe we can bring new partners and new entities and new interests to bear to say that this is the human health is why we're going to get involved in improving soil health for all of the various reasons that we know that's good.
And I would definitely say yes, in that we have a challenge area, our Healthy Soils, Thriving Farms challenge area that focuses on soil health. And then one of the areas we prioritize to look into is this soil health, human health interaction. But one of the things that has been, I think, expanded in my thinking since I've been here is we also have challenge areas in urban agriculture. We also have challenge areas in food and nutrition. And so I think there are some spaces in cross collaboration in those challenge areas that I wasn't thinking initially, even when I thought this is a great space to explore. So I'm excited to take this back to my staff members and talk more about how we could potentially collaborate.
So let's take that response as a springboard to go a little bit further. What obstacles need to be removed in each of your organizations to see this expand? Attention to it, possible funding. Bill, you're in a little bit different situation because you come out of a private sector entity, so you're thinking in terms of internal funding, although in theory you could even, Bayer could have cooperative agreements or something. But the rest of you are thinking in terms of in many cases funding, getting it to support researchers and so forth. What kind of obstacles need to be removed? What kind of obstacles to expanding this are there, and what needs to come off?
So I would say from the perspective of our foundation, for those of you who don't know much about our foundation, FAR, for every dollar that we spend, we're required to find a matching dollar of non-federal funds. So for us, the major barrier would be identifying other collaborating partners in the non-federal funding space that could partner with us. So I think in identifying other groups that want to work in this space with us, that would be our major barrier. I think we could work in the space and fund in the space as long as we can find additional partners that want to collaborate in the space with us.
Being a family foundation and a private foundation, we don't really have we don't have a match requirement. We don't have some of the restrictions and writing a specific RFA and having it through a process with a panel. We don't do that either. We make those decisions internally through our strategic planning. So it's really a matter of for us, is a better understanding of where this fits in with our goals, and maybe this is a loop. This is going to sound a little bit like maybe if this is the right term, self-fulfilling prophecy. Is we need to see and understand how this can soil health and human health can lead to reach the goals of the foundation. So we need to see that through research, but maybe we need to fund that research to be able to see that exists. But we can do that, and that's kind of one of the points of philanthropy is being able to move quickly and test ideas that may not be ready for other venues. So.
I would, well, first of all, I'm a program officer, so people call me a lot and say they want to study, they have a great idea, they're working with childhood-led exposure and have a way to keep people from being exposed to it. And we get calls like this frequently about a variety of topics. And when it's an environmental exposure question, a limitation within our institute is that it has to be driven by that human exposure connection. It has to be that disease connection, that biomonitor within the human body is a limiting factor for, I would say, almost all of NIH, but specifically, there are cases within NIEHS where, there are certainly great opportunities to partner with existing human health cohort studies, for example, to help also move forward your questions about soil health. But the main focus of that application coming in would need to be human health in most cases. There are exceptions within the Superfund research program, but again, usually that starts with a conversation with the program officer to try to find the right spot for your research interests.
So the challenge we face at NIFA is the communities, there's still a large proportion of the community that still likes to divide the science into what they think is the most important part and not trying to see the broader spectrum of how their science connects to the next part, connects to social science, connects to dealing with the human communities that are out there. And they just want to focus on that part. We can't solve problems by cutting up the science and saying, okay, I've solved my problem, it's your turn to solve your problem. It's more important for everybody to get together and identify the problem, so a cross-disciplinary approach to doing things can actually find solutions better, because sometimes the solutions to what you think is your problem comes from somebody else who sees the problem differently. So coming together and trying to understand an issue related to soil health and looking at different perspectives of it, even from the engineering perspective, from an economist's perspective, you will actually find more innovation in finding those solutions instead of just proposing things through your perspective and finding the solution that you think applies broadly, but it's really more specific. So it's the ability to think broadly, and that's why we're trying to train future scientists to think more broadly than, yes, we're trained in our academic profession to be very specific, to be knowledgeable about a certain topic, but we need to be able to apply that across the board so that we're addressing that problem also with someone from an engineering discipline, with someone from a different discipline other than yours, to be open to working in that environment. That's our challenge.
All right, we're technically out of time, but I'm going to ask one more question, real fast.
Sure. No.
Yeah. Such an administrator. LAKISHA did a great job of pulling together a good panel here, really diverse group of organizations to talk about this topic. My question is, this is a small stage, only get about 5 of you up here. Each of you, if it hadn't been you, what other organization should have been up here on the, what organizations have we not heard from in terms of potential funding and interest in resources for this topic that's not here on the stage? So just real fast, I'm putting you on the spot. LAKISHA, you're nodding, you go.
No. Look, I know because I put the panel together and I know who I invited and they couldn't come. So, but it would have been, and they would have been here except they had conflicts, but it would have been the Gates Foundation. And the only reason why is that their Grand Challenges meeting is right now, and so most of their staff is there. But it would have been, for me, that would have been another foundation that I would have invited, yeah.
My snap thought was states. You know, that there are organizations. Well, I often say when I'm on panels like these and you ask something, it's like farmers. But I think that's a niche for this group. I mean, you always need to involve those stakeholders, but they're not the only stakeholder in the soil health and human health connection here. There are other stakeholders as well, but I think there's the states, and whether that's the State Department of Agriculture or the State Department of the Environment, whatever they're called, I think the states have resources and interests in this.
I think there's tremendous potential within the small business innovative research arm of many institutions that have funding. So even within NIH, we have an SBIR group as well. So you might shrug your shoulders and be, well, I'm not a small business, but you'd be surprised how close your idea might be towards something that's commercializable. And a phase one SBIR grant is another venue that can be used to take your idea to the next level. So I would say there might be a lot of opportunities there as well.
So I'd give up my spot to 2. Leadership of the agriculture experiment stations at the land grant, and leadership of cooperative extension.
And I'm drawing a blank. I think all the good ones were given.
Yeah, ditto. All right, well, thanks very much. Thank you.